Hello, I'm Dr. David Hornbrook, and today we're going to see 10 beautiful e.max veneers on our patient Robin. One of the most important aspects of this entire process is gingival health during the provisionals. Robin's had her provisionals on for 2 weeks, and a question I'm often asked is, how do I have my patients maintain their provisionals and gingival health? So we actually did a little bit of laser on Robin. So what we do after the provisionals, after that next visit, I go ahead and give them a rubber tip instrument. This happens to be just a gum rubber tip. I tell them to take this rubber tip and very gently go up into the sulcus 3 or 4 days after we did the laser, and typically about 3 or 4 times a day. After the 3 or 4 days, I give them 2 syringes of material. I actually give them a couple of this, and this is hydrogen peroxide. And I just tell my patients that if they run out, just refill it with 3% hydrogen peroxide that they would get at CVS or Walgreens. And what I want them to do 3 or 4 times a day, and this is an Ultradent tip that's just screwed on this 3 cc syringe. I just tell them to go around those edges 3 or 4 times a day. It just cuts down on anaerobic bacteria and just keeps the gum very, very healthy. And then she can rinse and just spit into the sink. So I have her use the hydrogen peroxide for all the days prior to 3 days before cementation. Then I give them another syringe. This is part of a kit with instructions. This, and you can probably see it's a little bit of blue in color. This is a chlorhexidine, kind of like Paradex. And same Ultradent syringe. I tell Robin 3 days before I see you next time, that's actually the cementation date, so that would have been 3 days ago, I want you to switch from the hydrogen peroxide to the antibacterial mouth rinse. And for 3 days, 3 or 4 times a day, she's going to take the Paradex or the chlorhexidine, and she's going to go around the gums. And what that does, it just makes those gums so healthy. Even some of our patients that struggle with excellent oral hygiene during this provisional stage, the tissues are immaculate. And you can see from the photograph that they're in perfect health. The reason I don't have them use the chlorhexidine for the entire 2 to 3 weeks between prep and cementation is the chlorhexidine can discolor the provisionals. So I hope that helps, and next time you're going to deliver some beautiful aesthetic restoration for your patients.